Good day, everyone. So today we will discuss the positive contrast media, which are used in special radiographic procedures or special radiographic examinations. So the two positive contrast media that are used are the barium sulfate and the iodinated form or the iodinated contrast media. So for barium sulfate examinations, this include the esophagus, examination of the esophagus, the small intestine, and the upper GI series, as well as including also the colon. And the atomic number of barium is 56, while for iodinated contrast examinations include the GI or the gastrointestinal tract, the kidneys, gallbladder, pancreas, heart, brain, uterus, spinal column, arteries, veins, and joints. And the atomic number of iodine is 53. So, positive contrast media must have high atomic number. That is why we are using this barium and iodine so that they will absorb X-rays or radiation and that the structure will appear radiopaque or white on the radiograph for AC evaluation. So these are the examples of examinations that use barium. So the barium swallow or the barium meal, barium enema, and barium follow-through examinations. The indications for performing barium examinations include dyspepsia, upper abdominal mass, reflux diseases, unexplained weight loss, partial gastric or duodenal obstruction, GI hemorrhage, and suspected hiatus hernia. While for the contraindications, so yung mga conditions na hindi pwedeng mag-undergo ng barium examinations ang isang patient, so this include complete, that is bowel, not bowel, complete bowel obstruction, suspected perforation, and pregnancy. So we also have to consider important factors in selecting contrast media. Of course, it must be safe, must be non-toxic because it will be administered to the patient, must be enough, must be adequate to cover the entire structures needed, must have a suitable viscosity or the ability to resist flow. I will define this term naman later. Must have appropriate miscibility or immiscibility. So when we say miscibility, it refers to the ability of a solution to mix with uh, other particles, other substances like water. The physiochemical properties of contrast agents include water solubility, which is defined as in vascular applications, an immediate dilution with blood. So meaning if the chemical or if the contrast agent has water solubility, so it can easily be mixed with water or can be diluted with blood. For viscosity, this is a measure of the fluidity of solutions and it is measured in millipascals per second. The higher the viscosity of the solution, the longer it will take for the contrast medium to be diluted by blood. So again, when we say viscosity, it is the ability to resist flow. So if sabi dito, the higher the viscosity. So the higher the viscosity, meaning mas resistant siya to flow. So the longer it will take for the contrast to be diluted by blood. Hindi siya madaling, kumbaga matunaw, madilute ng blood. So therefore, we can have more time to evaluate that structure. Kasi kapag mas madali siyang madilute ng blood, hindi siya mawawala. So, kailangan natin bilisan yung examinations para makita natin yung structures agad kasi pag hindi, So, pag nawala na yung contrast, so wala na tayong makikita or magiging poor yung detail ng structures natin. And for another term is osmolality. It is a measure of the total number of particles in a solution per kilogram of water. So we have the term low osmolality contrast agents and high osmolality contrast agents, especially yung ating iodinated contrast agent. So we have what we call the LOCA and the HOCA. So again, as I have mentioned, we have the LOCA and the HOCA. So LOCA or low osmolality contrast agent and HOCA for high osmolality contrast agents. So these are under the iodinated contrast agents or contrast media. So between the two, ang kadalasan ginagamit is HOCA or high osmolality contrast agents because they are cheaper compared to LOCA. But when it comes naman for the comfort of the patient as well as for the safety of the patients, so LOCA naman ang recommended. So kasi pag HOCA, meaning there are higher, kasi high, di ba? High osmolality contrast agents. Sa HOCA, higher ang number of particles in a solution per kilogram of water. So most likely, because mas maraming particles in this solution, so most likely, mas common din ang mga adverse reactions or allergic reactions. So kaya nga lang, mas mura nga siya. Pero pag LOCA naman or low osmolality contrast agent, so lower ang number of particles in a solution per kilogram of water, therefore it is safe, less din ang adverse allergic reactions sa patients, and safer siya especially for pedia patients as well as for the elderly patients and for those patients with special considerations na kailangan like yung may mga kidney problems and other conditions na medyo delikado siya actually, pero kailangan mag-undergo ng contrast examinations. That is for osmolality. So adverse reactions to contrast agents have been related to osmolality. So yun nga yung nabanggit ko, the adverse reactions of the patients are most common sa HOCA kasi nga mas maraming particles in a solution, whereas sa LOCA, so less adverse reactions. So for the characteristics of barium sulfate, again, it absorbs water, high atomic number, water insoluble. So hindi siya madaling matunaw. Hindi naman siya actually hindi natutunaw. Hindi siya madaling matunaw ng water. And actually, it will or it can absorb water. So, yun, mas maputi siya, mas madali makita yung structures. It cannot be absorbed by the GI tract. So, therefore, pwede rin siyang, hindi pwede. It cannot be absorbed by GI tract. So, therefore, mas makikita natin yung structures ng GI. Non-toxic, therefore, it is safe. And types of barium sulfate include commercial and plain barium sulfate. For commercial, so examples are the Barodens, Barospers, and Barogen. So these types of commercial barium sulfate have flavorings and other additives para hindi naman ganun kasama yung lasa niya. So usually yung mga available na flavors, they are available in lemonade, fruit punch or orange juice. Meron ding iba, strawberry. So, it varies. For the plain barium sulfate, so wala siyang additives, wala siyang flavorings, very unpalatable taste. So, yun nga sabi nila sa mapakla. Adheres well on the mucosa of the organ. So, yung advantage naman ng plain barium sulfate is it will be, it will coat the mucosa of the organ. Therefore, mas visible siya compared sa commercial. Although, ang commercially available naman is visible naman siya, pero mas yung ating plain barium sulfate. So when preparing barium sulfate for administration to the patients, so it is recommended to be mixed with a cold tap water, usually from 40 to 45 degrees Fahrenheit. So the purpose of mixing barium sulfate with cold tap water is to reduce irritation to the colon, aid the patient in holding the enema, meaning it can increase the retention of the contrast media during examination. So ibig sabihin para hindi siya madaling i-excrete ni patient or ano bang tawag dito? It reduces the urge of the patient to excrete the contrast. The cold water reduces spasm and cramping, as well as it has been reported that the cold water can provide anesthetic effect on the colon. So the room temperature of water is recommended by most experts to produce a more successful examination with maximal patient comfort. Take note, the rad tech should never use hot water. So never use hot, okay? So never use hot water because it may scald or burn the mucosa lining of the colon, which can result to further complications, okay? So cold tap water. So there are so yung recommended natin is cold tap water between 40 to 45. But also, there are some experts that recommends room temperature water, which is 85 to 90 degrees Fahrenheit. This is about 26 degrees Celsius. So this is a room temperature water or yung ating tap water. Room temperature. So either cold tap water, and some experts also recommend room temperature water. So this is to produce again more successful exam with maximal patient comfort. But if you want to provide some anesthetic effect to the patient, so we can use cold tap water to be mixed with our barium sulfate. Next, for ionic contrast media or for the iodinated contrast agents, so they are negatively charged acids containing iodine that ionizes in solution and causes more patient discomfort. So more patient discomfort for ionic contrast media. So examples of this are Eurovision, Eurographene, Angiographene, Hypake, Conray, Euromyro, Eurovist, and Telebrix. Actually, mas marami pa siyang available na brands na available in the market today. For non-ionic contrast media, so it does not ionize in solution. It is safer compared to ionic contrast agents, less painful, and better tolerated by the patients. So yung ating ionic kanina, so they are also what I mentioned earlier as HOCA. So, HOCA for high osmolality contrast agent. Ito yung mga ionic. So, more discomfort kay patient. Also, common din ang adverse reactions. For non-ionic, ito naman yung ating LOCA. Examples are Ultravis, Ayupamyro, Omnipate, Amipate, and Isovist. And we also have here the corresponding generic names. So, Iupromide, Iupamidol, Iuhexol, Metrisamide, and Iotrolan. So, these are non-ionic contrast agents, or they are also referred to as low osmolality contrast agents. Again, these are comprised mainly of iodine. So for the administration of the contrast agents, the bago tayo mag-administer sa patient, so it is also required to perform sensitivity test just in case magkaroon ng allergic reaction sa patients, at least na-test natin yon and hindi na natin itutuloy yung examination just in case magkaroon ng allergic reaction sa patients. So for the sensitivity test, this is done to check the patient's tolerance to contrast agent. Also, this can serve as test dose para malaman natin kung ano yung magiging possible reactions ni patients or kung meron man or wala. So usually in sensitivity tests, so ang ina-administer kay patient is 1 cc or 1 ml of contrast medium. And then we will wait for a period of time and we will observe the patient. Kung walang allergic reactions, so meaning we can proceed with the examinations as scheduled. Pero halimbawa, if the patient will present allergic reactions, so dapat may nakatambay din antihistamine drugs to be injected to the patient kapag nakakita tayo ng allergic reactions. So, sensitivity test routes include scleral, sublingual, intradermal, and intravenous. So usually, familiar tayo sa mga allergic reactions katulad nito. So, red eyes, sneezing, rashes, so itching, tearing, runny nose. So these are common allergic reactions, not just to contrast agents, but to any allergens. So pag sinabi nating allergens, these are agents that can cause allergic reaction sa katawan natin. So when we are in contact with a specific type of allergens, so our body will produce histamines. Kaya nga kailangan natin antihistamines. So these allergens can range from fruits, nuts, sun exposures, pollen, insects, dust, and there are other types of allergens. So different person will be allergic to different stuff. So, merong iba allergic sa, di ba may movie dati? Yung iba allergic sa wifi. So, mga very, very uncommon siya. Pero, maybe. So, hindi natin masasabi. So, these are just common allergens. For scleral method, so 1 drop of contrast medium is put into the sclera, of course, kasi nga scleral method. Sublingual naman, 1 drop, yung 1 cc na sinasabi natin kanina, 1 drop of contrast medium is deposited into the inferior base of the tongue. So, under the tongue siya sa inferior base. So, sublingual. And for intradermal, so 1 cc of contrast medium is injected just beneath the skin, just under the dermis. Okay, pag sinabi natin sclera, ito yung white part ng ating mata. For intravenous, so 1 cc of contrast medium is injected into the vein. So yun yung sa scleral. Sublingual, we have the intradermal. So yung intravenous, familiar naman tayo doon. So medyo mas mataas yung angulation ng ating syringe, ating needle, pa mag-inject naman sa intravenous. So methods of administration of contrast agents include direct and indirect method. For direct method, so this includes barium enema. So also pwede rin siyang retrograde pyelography and cystoscopy. So ibig sabihin, directly nilalagay sa structure yung barium. While for indirect, so pwedeng pinapainom or pwedeng parenteral. So pag sinabing parenteral, pwedeng intradermis, intravenous, siya for the appearance of the barium sa ating structures. So we have here the kidneys, the ureters here, and then we also have this urinary bladder. As for the preparation for contrast exams, so we have internal and external preparation. For external preparation, of course, kailangan i-remove yung clothing, especially if may mga buttons, botones, metals, metallic objects must also be removed, and anything that will cover the area of interest. So failure to perform this external preparation may result to inadequate double dose of radiation to the patient. So magiging double dose, kumbaga, kasi nga kapag may mga metallic objects, may mga buttons, and other structures na naka-cover or nag-superimpose sa ating structures, we may need to repeat the examinations, and that will entail additional patient dose, unnecessary exposure. For internal preparation, so cleansing enemas may be recommended, cathartics like the Dulcolax and insertion of suppositories, as well as MTO or withholding of food intake for many hours, 10 hours, 8 hours, depende sa protocol ng facility. Cleansing enemas are performed so that the structures in the abdomen are not obscured by gas and fecal material. So, kailangan gawin ang cleansing enema so para ma-ensure na malinis yung kanyang kaloob-looban, malinis ang kanyang budhi, malinis yung kanyang colon para hindi ma-superimpose ng gas and fecal materials yung structures. This preparation may be employed by the patient itself kung alam ng patient paano gawin, or pwedeng yung family members niya, pwede siya umuwi, tapos yung family members niya lang yung assist sa kanya or magpa-perform ng cleansing enemas. But most likely, kapag ganito yung instruction kay patient, so usually ina-admit siya for a night before the examinations, because the nurses are usually the ones that are performing cleansing enemas to ensure na tama yung procedure. Kasi sayang naman if halimbawa si patient na yung perform yung cleansing niya, and the next day perform examination, marami pa rin mga fecal materials and gases na naiwan din sa loob, superimpose receptors. So, uulit na naman ng preparations. Kailangan, syempre, additional cost din kay patient kasi kailangan yung bumili ulit ng barium for another examination. So, hassle siya. So, in the run, for preparation of the patient will not become common problem to both nursing and radiology department as long as it is done properly. So, halimbawa, we have here So, may mga fecal materials pa. So, nakakover niya yung structures. So, masyadong kita. So, supposedly, may presence ng gas. So, kapag maganda yung enema, yung cleansing enema, so nakikita yung mga structures. Next, the reaction of contrast media. So, we have reaction 2 pala, hindi of. Reactions to contrast media, we have minor and major reactions. So the contrast media may create or may cause reactions to the body. And for this reason, it is very, very, take note, it's very, very important to obtain the allergic history or the medical history of the patients to know kung ano yung mga uh, existing allergies nila for a specific drug. For minor reactions, this can include urticaria or yung ating hives or yung pantal-pantal, sneezing, flushing, yung pamumula, nausea, vomiting. So these are the different mga minor reactions lang siya. So usually with these minor reactions, no treatment is needed other than reassuring the patient that is a normal and minor reaction. Hindi siya actually normal, pero minor reaction lang siya. And also, as a healthcare provider, we must ensure na kapag halimbawa susok si patient, may ready ng vomit bowl. Supervision is also very important. For major reactions, the bronchospasm, which can cause wheezing. So, yung bronchospasm, where the airways that connect the windpipe are called the bronchi, and sometimes the muscles that line the bronchi tighten, kaya ng spasm. Tighten and may cause the airways to narrow, kaya nahihirapang huminga, and it limits the amount of oxygen that your body receives. And this can be life-threatening. Kaya major reaction siya. For laryngeal angioneuritic edema, so it can cause choking. So angioedema is an area of swelling or edema of the lower layer of the skin and tissue just under the skin or mucous membranes. So this can also be yung angioneuritic edema can also be referred to as Queen disease. It is a well-localized edematous condition or swelling condition that may involve deeper skin layers, subcutaneous tissues, and mucosal surfaces of the upper respiratory and GI tracts. For vascular collapse naman, so this happens when the patient is placed to pale and sweating and may lose consciousness. While for respiratory failure, when the patient becomes cyanotic or bluish and may stop breathing, then convulsion, and pinaka-worst is coma. So all these major actions require prompt or immediate and efficient treatment to be able for the patient to survive. Kasi nga major reaction siya. So let me add pala for the minor reactions. So it includes metallic taste. Metallic taste. So kasi way before, may lumabas sa board exam. So isa siya sa mga choices. So it is considered metallic taste of contrast or iodine or barium. So metallic taste daw siya. Ito siya for bronchospasm or pwede rin laryngeal angionuretic edema. So we will end here.